is a mock transfer done without taking shots? So I think they're referring to the ERA. So I would say usually I do it as a what's called a controlled frozen embryo transfer cycle, where we give medications to simulate what would happen in the normal cycle. So I do use shots for that, and it's usually progesterone shots for 5 days, and then we would perform the ERA on the 6th day of the progesterone shots. And then, can a tilted, slanted uterus cause miscarriage, or can I carry a child? Ruhi, you want to take that one?
Yeah. I was going to say, so it says that you did a ERA without any shots. It depends how you prep, and I know you would agree that so your mock cycle is a cycle before your embryo transfer, and it's supposed to be prepared the exact same way you would as when you're doing a transfer. And the best way to gauge it is we're looking for receptivity, and I tell my patients it's like a Velcro strip. So imagine your Velcro strip misaligned. So if your uterus is one end and your embryo is the other end, and if it doesn't align, and like your Velcro strip, you put it halfway through, it's not as strong, so it slips off. That's exactly what the ERA is. And Anu's right, we do it mostly in hormone prepared cycles. So if the ERA comes back and says, no, you need more progesterone duration or less progesterone duration, you can adjust it. When you do it in a natural cycle, meaning no shots, then it's harder to adjust because you can't control how you prepare for that because you're relying on your body. So do people do ERAs without shots? Yes. Is it hard because we don't really know what to do with them when you get the result? Because if it comes back and it says, oh, give her one more day, well, we're not giving anything, so you're kind of cornered. But yeah, and then can a tilted uterus cause miscarriage? No. So uterine position is how your uterus lies, and there's 3 ways, and it changes position. So it's held on by ligaments to your sides, and in the middle, because the uterus is kind of bigger, it swings back and forth. So it can swing up, anteverted, it can swing back, retroverted. It could stand in the middle, axial. If it has scar tissue from a previous C-section, it could be tilted, but it shouldn't cause miscarriage or infertility. That's just uterine position. You agree, Anu?
Yeah, and I tell patients, that we do take an interest in the position, mostly for procedures we have to do, like the IUI, the embryo transfer. So we want to make sure we're pointing the catheter in the right direction and that type of thing, but it's not associated with infertility or pregnancy loss in itself. Okay, great. With a comment saying how brave and wonderful all of you ladies are. What is the process of IVF? So IVF stands for in vitro fertilization. So it's a process of basically stimulating the ovaries so that all the follicles will grow. Usually in a normal menstrual cycle, 1 follicle will grow and the rest die off. So what we're doing with IVF is we're just trying to stimulate the ovary to grow all the follicles that are there. And then ultimately you'll undergo an egg retrieval, which is a minor surgical procedure to remove the eggs. And then the eggs would go to the lab and we would get a sperm specimen. We put the egg and sperm together. This is done by the embryologist in the lab. And then we have an embryo. And then that embryo will sometimes be tested for its genetic normalcy, or like Anita's case also, diagnosing the BRCA gene. And then typically we'll then freeze the embryo and then come back the next cycle. And then once we have the results for the embryo biopsy, and then we'll prepare the uterus for a transfer, which involves usually taking estrogen and then taking 5 days of progesterone and then putting the embryo back in on the 6th day of progesterone. That's kind of an overall summary. Ruhi, would you add anything to that?
No, I think that's a great summary. I think I'd add something as a patient, and I hope you guys all agree. I think when I would hear IVF, even though I practiced, I was a fellow when I went through my first cycle, I think I had a hard time separating my emotional burden and feeling with my medical feeling about it. So medically, it's not as scary and invasive. It's exactly the same duration as an IUI and the same number of appointments. I think emotionally, because you're built to think that it's like your pivot, your very top, right? Like you're at the iceberg, and if this doesn't work, then that's it. So I think the fear of IVF is scarier than the process of IVF itself. Would you guys agree?
Yeah, I would agree.
100%. You know, I think because you're like, okay, I'm going to try all the other less invasive or the more conservative options because I don't want to be, you know, get to that ultimate or, you know, penultimate, you know, thing of having a child via IVF because I'm going to be labeled that I couldn't conceive on my own inside my own body. And so I think that's the fear of it. And, you know, I'm sure all the ladies would agree. It's not as terminal as it sounds.
Yeah, yeah, that's a good word. I like that. There's something about PCOS, but we can cover. Anu and I are doing a PCOS talk next.
Perfect.
Right,
Yep.
so we'll cover that one in there.
Perfect.
And then there's one more. What do IVF injections feel like at every step? And is there anything lifestyle-wise that a woman can do to increase her fertility? Anu, do you want me to take the first one and you want to do the lifestyle?
Sure.
Okay. They actually look much scarier than they feel, right? And I think mixing them is the hardest part. I remember getting that box of medications and I literally was like, oh my God, what did I get myself into? Like,
Yeah.
I had no clue what to do with them. And I still remember the conversation. My husband's like, are you sure you're a fertility doctor? Like, I am, but we don't do this. Nurses do this. I swear we don't do, like, I don't know what to do with them. It's like asking a doctor what is, you know, like, how do you administer chemo? I was like, I have no clue. And I was so scared. And I remember calling my nurse, like my IVF coordinator, like, please tell me which goes in the fridge, which ones do I keep out, how do I mix this, what are needle gauges? I never knew until I did my IVF cycle what are different needle gauges. I was like, wait, if the number goes up, it's smaller, so I want a big number. It's like, but it's not scary. I think that first couple of days, like learning how to do it logistically was the hard part. But they feel like, I don't know if anyone here's old enough to remember that TB shot, the one that you used to get in school. It feels literally just like that, like a really quick mosquito bite. And this is coming from a girl who passed out with every needle. Like, that was one of another reasons why I didn't want to do IVF, because of the injections. And I would see a needle and I would literally be on the floor passed out. They'd have to give me that little whiffy thing, like drag me across the floor. But yeah, I am a surgeon in real life, I promise. I can cut everyone else open. I just don't want it near me.
I will say, for the ladies who are afraid of needles, because I'm very afraid of needles as well, the topical lidocaine, which you can buy on Amazon, it's like 5%. It's like Numb 25 or any of them. You can even get any other generic brand of topical lidocaine. Putting that on and putting on an ice pack right before you get the needle, it is almost a numb process. I trained my husband to become an expert at this. He would put on the numbing cream, go shave. My whole bottom was nice and numb. He'd bring the ice pack, put it on, and then do the shot. So we would have a routine every morning before he went to work. So any of you who are fearing the needles as much as I did, that's a little trick for anyone who's out there.
Yeah.
Anita, I remember you shared, I think your husband or your fiance at the time, maybe, right? That he did shots, right? Like saline shots.
So yeah.
I shared it with my patients, by the way. And
do that.
one husband said to me, "Why would you ever say that to us?" And I was, that's the funniest response I've ever seen. It was hilarious. I love that he did that.
Yeah, I wouldn't let him give me the shots because it was almost, he was willing to, but for me it was a pride thing. I was like, I'm a pediatric critical care doctor. I can give myself a shot. I promise you guys, the first shot I had to give myself, it took me an hour. I stood there with the needle next to my stomach for an hour. And that's why my husband was like he grabbed the needle and he's like, I'm going to do it with you.
Sweet.
Don't do this, guys. But still, it was very sweet. And flash forward, I had gestational diabetes, so I had to get really used to giving myself shots.
Yeah, I remember I'd come home from work like to get the progesterone shots. Like right when I'd get home, we do the progesterone, and my husband would give it to me. So we do like a little dance after. He's like, yeah, see, we're gonna do a progesterone. I mean, we were like, I mean, it was just like he knew how like, you know, sometimes I would get upset when we were doing it, so he tried to find a way to like liven up the mood, you know. So now we have like good memories from those times. So whatever you can do to kind of lighten up the mood helps.
For sure. And then the last one, lifestyle to increase fertility.
Yeah, so I mean, I always recommend healthy lifestyles. So diet and exercise. Usually, we recommend a Mediterranean diet: the fruits, the veggies, poultry, fish, healthy like fat, so olive oils, avocados. Exercise, not actually during the stimulation, but like leading up to it. So usually, I would recommend 4 to 5. Days a week doing high, you know, as much cardio, high impact that you can, but getting your heart rate up and intermittent weights and just overall just trying to be healthy, taking a prenatal vitamin. Also, you know, of course, avoiding alcohol, smoking, you know, those type of things, minimizing caffeine. If diminished ovarian reserve is an issue, if we're worried about egg numbers, I'll also have patients take CoQ10 and DHEA supplements. Sometimes patients will ask me about acupuncture. I tell them there's not really great data that it improves outcomes, but I'm an advocate for anything that will decrease stress going through this process. So if acupuncture is that for patients, I'm in favor of that, or massages or walks with your partner, whatever helps to kind of take the stress away as you go through is usually what I counsel patients for.
Completely agree. And then as South Asians, I did a study on this that we have some vitamin D receptor deficiency, and vitamin D has been shown to play a critical role in miscarriage and egg quality. I'm sure all of you who have gone through fertility have had their vitamin D tested. And correct me if I'm wrong, everyone, no matter how much you're on, you're always borderline or low. And I swear it's a vitamin D receptor deficiency that we carry as South Asians. I will one day figure it out, but I swear to God it is. And it plays a huge role in fertility. And then, like Anu said, anything rich in antioxidants helps because the pathophysiology is very similar to cancer and inflammation. And our food tastes really good, but very inflammatory.
I think we're up on time. I guess any last thoughts?
I think everyone should just go around and say their handles so that everyone knows where to find us if they have any further questions.
It's a good idea.
Yeah. I know you want to.
Sure. I'm Anu Kathiresan. My handle is Anu Kathiresan MD on Instagram. Ruhi?
My name is Ruhi Jalani again, and my handle is Ruhi. There's a dot? Is there a dot? I don't know.
There's not a dot.
There's no dot. It's Ruhi Jalani at biosfertility.com. Guys, these are really my family members, I swear. Thank you, ladies. I love you all.
That's okay. I actually just peeked at my Instagram handle just to make sure I get it right. So mine's at Dr.Dr_Flo Sinha, and feel free to message me anytime. I think I could speak for everyone to say that we are your cheerleaders. We are in your corner. We're here to support, vent, cry with. I mean, I think I cried with every story just because hearing it over and over again is just, it's emotional.
I'm Amita Kundra, and you can find me at Amita Kundra MD on Instagram.
And I'm Anita Patel, and I'm Anita K. Patel, MD, on Instagram. We're all very original.
Makes it easy to find.
I'm Kumkum Patel, and you can find me on drdr.gut_motility, or you can just look me up by my name, Kumkum Patel, on Instagram.